Hello, everyone, and thank you for joining us for the panel discussion on the role of the private health sector in provision and the maintaining of the essential health service, which actually is a part of the RC68 marketplace event. My name is Hassan Salah. I'm the primary health care regional advisor and the team lead for the access to health service in WHO EMR. Our agenda will start with a brief presentation on the topic of the panel, and then we'll follow with questions and answer to the panel members. First, I would like to welcome and introduce the panel members alphabetically. We'll start with Dr. Andripan Chatterjee, Regional Advisor, Health and Nutrition from UNICEF. Dr. Andripan, are with us? Yes, great. Dr. Ayub Jalauda, Regional Advisor, Nutrition, WHO EMRO. Dr. Hala Saqr, Regional Advisor, Violence, Injuries, and Disabilities, WHO EMRO. Dr. Hamid Ravaji, Regional Advisor, Hospital Care Management. Dr. Hisham El-Berri, Medical Officer, Non-Communicable Disease. Dr. Hoda Yusuf Ata, Coordinator, HIV, TB, Malaria, and Tropical Disease, WHO EMRO. Dr. Khalid Saeed, Regional Advisor, Mental Health and Neurological Disorders, WHO EMRO again. And Dr. Khalid Siddiq, Medical Officer, Child Adolescent Health. In addition, of course, and the last but not least, our colleague, Dr. Shebl, Regional Advisor, Sexual and Reproductive Health, UNFPA. We're going to start our first part of this panel discussion with brief presentation from Dr. Aya Thabit about the study overview and the scope and the methodology. Dr. Aya is WHO EMRO focal person for the private health sector. Over to you, Dr. Aya, please.
Thank you, Doctor. Sharing my screen now. Should be on in a minute.
Yes, thank you.
Okay. My presentation is covered into two parts. In the first part, I'll just give a quick introduction, then we'll be opening the floor for the panel discussion. First, I'd like to start off by defining what we mean by the private health sector. The private health sector in general includes all non-state entities, individuals, and organizations whose primary purpose is to promote, restore, or maintain health. In the context of service provision, the private sector, however, includes individuals and organizations that are neither owned nor directly controlled by the government and which are involved in the provision of health services. It can be classified into subcategories as for-profit, not-for-profit, formal and informal, as well as domestic and international. The private health sector is exceptionally significant in the Eastern Mediterranean region. If we look at some of the percentages of the provision of the private health sector to essential health services in Iraq and Egypt as an example, we'll find that 90% of women of reproductive age in Iraq rely on the private sector to access modern methods of contraception. 71% of the deliveries take place at private facilities in Egypt. Moreover, 78% of diarrhea cases and acute respiratory infection cases in children under 5 in Egypt are treated at private health sector facilities. The private health sector is thus considered to be a major stakeholder in the provision of essential health services in the region. Accordingly, WHO EMRO conducted a thorough thematic analysis of the role of the private sector in 10 programmatic areas in recognition of the sector's potential of contribution to universal health coverage. In the interest of time, I won't go through all of them, but please feel free to reach out for more details. The objectives of the assessment studies were to explore the operational environment of the private health sector in health-specific topics with respect to governance, service delivery, financing, health information system, as well as documenting and showcasing examples of intersectoral collaboration. The methodology of the studies involved two sequential phases. In phase 1, we conducted a desk review, while in phase 2, we conducted targeted expert interviews to be able to fill in the information gaps that were identified in phase 1. This applies to all the studies that will be discussed during the course of this panel discussion, except for the mental health study whose data was extracted from WHO's 2017 Mental Health Atlas. This brings us to the assessment areas that we'll be discussing now. So the main objectives of today's panel discussion is to go through the key highlights of the assessment in nutrition-related interventions, communicable diseases, reproductive, maternal, newborn, child, and adolescent health, emergency care services, non-communicable diseases, and mental health. Over to you, Dr. Hassan, for moderation.
Thanks a lot. Thank you very much. Emergency care system is often the first point of entry in the health system. And my question to Dr. Hala, why the private health sector engagement is important in planning and the provision of the emergency care system and services? Over to you, Dr. Hala, please.
Thank you, Dr. Hassan. In fact, emergency care systems address a wide range of conditions, whether they are medical, surgical, or obstetric, and they are an essential component of universal health coverage. The essential role of emergency care services was very clear during the COVID pandemic response, where frontline emergency units have been the entry point for catching up the potentially positive COVID-19 cases and in transferring these patients between the facilities. Meanwhile, the private health sector, as we could see from the presentation, is very active in the region and growing with increasing paces. The emergency care and the private sector's contribution to it are continuing to develop in the region. And the private health sector, with all its resources, plays a significant role in different areas of healthcare, including emergency health services alongside the private sector. So it is a key actor in the overall national capacity to develop emergency care services, whether at the pre-hospital or at the facility level within the continuum of emergency care in relation to direct care delivery, but also beyond this, for example, for supply chain, for workforce training, etc. If we think about scaling up the coverage and the quality of emergency care services, it is very clear that we cannot do this without engaging the private health care sector. It is not an option anymore, it is a necessity based on agreed quality essential health services, an agreement on what we mean by quality and ensuring that both the private and the public sector are aligned in terms of the standardized quality of care. This engagement, again, I would like to emphasize, is not only in terms of direct healthcare facilities, but also in some other elements, such as the pharmacies, such as the supplies, such as the hospitals and staffing, particularly at times of crisis, such as the COVID-19 pandemic. It was very clear from the COVID experience that it is important to maximize the benefit from all national resources, whether in the public or the private sector, in order to offer time-effective solutions to meet the increased demand and maintaining the operations when the governments are overwhelmed. Without engaging the private sector in a meaningful and structured way based on agreed principles of transparency, of data sharing, of equitable distribution of resources, given the significant proportion of its contribution to healthcare in the different countries in the region, we would not be able to achieve what we want in terms of equitable and universal coverage of different services, but mainly in our case, we're talking about emergency care services. Thank you.
Thank you very much, Dr. Hala. Definitely, without full effective engagement with private health sector, no way that we can reach to the universal health coverage. Talking about the challenges facing the private health sector, and my question to Dr. Hoda, what are the challenges and the weaknesses that obstruct the proper engagement to the private health sector in communicable disease in our region? Over to you, Doctor.
Thank you, Dr. Salah and colleague. I would like to acknowledge the fact that the private health services offer significant contribution to the control and elimination of communicable diseases. In some countries of our region, it even reach up to 80%, as mentioned. And let me highlight the challenges here using the health system lens. I will start by the governance. What we noted that the awareness and the engagement of the private health services in the development of the National Strategic Plan for Control and Elimination of Communicable Diseases is often limited or lacking. And this raises a problem in monitoring and evaluation of such plans. I will come to the issue of financing and highlight that the service to the private sector often paid by out of pocket, and it may result into some catastrophic cost, particularly in some chronic diseases like tuberculosis. And in our strategic plan, in the global TB strategic plan, we have an indicator of reaching zero catastrophic cost to the TB affected families. And this represents a great challenge in our region. Coming to the issue of empowerment of private health provider for providing the case management of communicable diseases. What we noted that is a compliance of the private health services provider is very poor in terms of diagnosis and treatment. There is lack of awareness about the updated national treatment guideline, the diagnostic guideline. I will give a specific example in malaria, for example. The private sector is oftenly treated the malaria cases based on presumptive diagnosis without complying with the requirement for confirmation. And it results actually into a spread of antimicrobial resistance, whether in TB or in malaria or others. Why there is a poor compliance? It is often related to the poor engagement of the private facilities in the training and the systemic awareness related to the management of diseases. The issue of information, if we look at the national information and the surveillance system, the data is often lacking from the private health facilities. And this is particularly important for communicable diseases under elimination, where every case counts, and we are missing significant data from the private facilities. Again, in spite of the huge delivery from the private sector for controlling the diseases, particularly in the rural areas and by general practitioner, there is an issue of the quality of services. And the quality of services is highly important in this era. And the quality of services is affected dramatically in certain settings, as I mentioned, in the rural areas. And another issue is the continuity of care. The private health facilities don't have the issue of proper follow-up mechanism, and patients are often lost because of the high cost. And this results into loss of continuity of care, which is very important in the management of communicable diseases. I will end up by the focus is mainly on curative care, but in the era of communicable diseases, in the area of communicable diseases, we emphasize on the importance of preventive and promotive care. It's a continuum until the end, and this is not often existing in the private health facilities. I will end here. Great, thanks.
Thanks a lot. Thank you very much, Dr. about this. Definitely about the quality of care. It reached to the poorest quintile of the population. Actually, they go for the private health sector and looking for the quality of the service, and they pay out of pocket. So this is one of the major attraction to the private health sector. Let us move to the nutrition, and my question to Dr. Ayub. How far the countries of the region achieved good coverage of the wheat flour fortifications by minerals and vitamins involving the private health sector? Over to you, sir.
Thank you, Dr. Hassan. In fact, micronutrient deficiencies almost very common in the region. 1/3 of the population are affected by anemia. And adding vitamins and minerals, especially iron and folic acid, is one of the strategic intervention and cost-effective to address anemia. Of course, most of the countries in our region responded positively to this initiative. And so far, we have more than 17 countries in our region implementing wheat flour fortification. But of course, still few countries are working on this initiative, and this initiative has been supported by WHO and UNICEF. Of course, the regulatory measures to make it mandatory is one of the key challenges we are working in the country. But of course, many countries have been taking proactive measures. This initiative also extended to also salt iodization, where iodine has been added to the salt to address goiter. And this almost very successful program, and most of the countries implementing salt iodization. So food fortification is one of the cost-effective intervention, is being implemented with private sectors very successfully, and we need to invest more in this direction. Thank you.
Thank you very much. Thank you very much, Dr. Ayub. Private sector has a major role in the mental health, especially with the current situation of the pandemic. My question to Dr. Khalid Saeed: what is the significance of the private sector engagement in the mental health in our region? Over to you, sir.
Thank you very much, Hassan. I think before I take up your question, I think it would be helpful to have a bit of a background to understand why mental health is important. First of all, we need to understand that mental health problems are extremely common. 1 in 10 people would have a mental health problem at any given time. And in our region, where there are a significant number of countries going through acute and chronic emergencies, the rates tend to double. So more than 1 in 5 people at any given time would have a mental health problem. And if you look at the lifetime perspective, 1 in 4 people would have a mental health problem sometime during their life. And 1 in 4 families would have one person having a mental health problem at any given time in their life. The second issue is that majority of the adult mental health problems start before 19 years of age, as much as 75%. And if you look at the population pyramid in this region, most of the countries have very large proportion of their population under 19 years of age. In some countries, as much as more than a third of the population is under 19 years of age. So that's why it's so extremely important. The other thing is that it is not that the mental health problems cause disabilities. They are the leading cause. 1/3 of the total disabilities are because of mental health problems. But they also contribute to deaths. How do they do that? One is suicide. It's the obvious thing. Close to 1 million people commit suicide. And second largest cause of death in young people is suicide. But in addition to that, people with mental health problems are more vulnerable to other chronic diseases, NCDs, communicable diseases like tuberculosis, HIV, etc. And people with mental health problems tend to die 15 to 20 years earlier, mostly because they do not get access to mental health care. And this is issue of mental health is not just about diseases. It's also an integral component of health. And this has been something which has been highlighted during the current COVID pandemic, that most of the populations are affected with distress. They may not have discrete mental health disorders, but most of the population certainly went through distress. Now, that brings me to the issue which you raised, that how private sector can help. So private sector can not only help through provision of services for mental health disorders, but also through, as Dr. Huda was mentioning, engaging actively in promotion and preventive programs like childhood parenting, for example, parent skills training, early sort of detection of problems with maternal mental health and how to handle that in school mental health program, because education is not only health, which is large private sector contribution. Education sector also has a very large private sector component. So again, that's why it's important that we need to think not only in terms of health, because as you know, health is not about just the formal health sector, it's other sectors as well. So we also need to think the private sector entities in other sectors. And that's why I'm giving you an example of education. Now, the second thing is that we also are seeing that a large number of medical and other institutions are now being run by the private sector. Private medical colleges are mushrooming all over the place. Same is the case with others. So private sector is not just about service provision. It's also about human resource development, and more importantly, possibly about human resource retention, because that's what we are also seeing, that people who go into the private sector often have difficulty in terms of the pace they are getting, the regularity at which they are getting, and so on. So private sector can also contribute to make sure that not only quality human resources are produced, particularly with enhanced component of mental health, but at the same time, they are retained through proper mechanisms. Thirdly, in UHC, you mentioned, and we have already seen that number of countries which are moving along this track are engaging private sector in achieving the universal healthcare goals. So again, we need to make sure that mental health is not excluded from the conditions which are being covered through the UHC packages. I mean, you can look at some examples where actually mental health is not actively there. They are saying it's not in the negative list either. So in fact, it is there, but actively it's not being mentioned. What is important is that it should actively be there in the interventions which are being covered through the insurance mechanisms or third-party payment mechanisms, whatever are in place. Then I think the issue of medicines. Again, medicine production and production of technologies mostly is being run in the private sector. So if we want to have psychotropic medicines available on a regular basis, and we are not saying that all the psychotropic medicines, we are saying essential psychotropic medicines, which are on the lists of most of the countries, they should be produced and be available on a regular basis in primary healthcare as well as up the chain, so that people can benefit from that. Side by side with that is the fact that people who are not in the health sector, like teachers, first responders, they should have a basic minimal training on how to handle basic psychosocial skills and how to help people with distress. So it should not be the job of the doctors or nurses only, but firefighters, police officers, these people, they should have basic psycho, and that's where private sector can help by expanding the reach in this area. And last but not the least, I think 2 points which mentioned, I think by Huda again, was the data. That mental health indicators often are not part of the routine HIS. So we need to make sure that mental health indicators are part of the routine HIS data system, so that the whole cycle, that the policies, strategies, and the resource allocation can be sort of geared according to the data. And then the resource allocation. Obviously, if you look at number of countries, the amount of public spending on health is extremely low in this region in general. And on mental health, it is minuscule. It's hardly there. So private sector possibly can help with sustainable financing. And lastly, research. We generally are not very good in this region when it comes to publications and local evidence generation. And private sector can help not only in determining the priority issues in mental health to be researched, but also probably incentivizing and providing grants for researchers and academic institutions to help with that. So I think those are the different options and different ways private sector can actually contribute towards enhancing access to basic mental health services across the region. Thank you.
Thank you, Dr. Khaled. Thank you very much. And definitely with your recent effort about merging of the mental health in the primary health care and to be part of the universal health coverage priority benefit package, definitely is going to be very useful in this work. Again, about the emergency care, my question to Dr. Hamid Ravaji. What are the main challenges regarding the role of the private health sector in planning and the provision of the emergency care service? Over to you, Dr. Hamid.
Many thanks, Dr. Salah. During our study that we did regarding the engagement of the private health sector for emergency care, the first thing that we realized was the limited information on the engagement of the private health sector for emergency care. And specifically, we didn't find a framework for the engagement of the private health sector for emergency care provision. And it seems that it is not a very attractive activity to the private sector. And there is a misalignment in goals between the public and private sector for a provision of the emergency care. The specifically roles and responsibilities of the private sector has not been adequately justified and defined. And also one issue that we found was the legislation issue. In most of the countries, there's not much mandate for legislation of the pre-hospital services and ambulance services. Most of the countries have mandates for the facility-based and hospitals. However, it is not adequately enforced, really. Another issue is the quality of the service provision, specifically by private sector. There's not much enforcement for the mandates and the legislation for this one. Some of the countries, they don't have enough standards. Some of them they have, but it's not enforced. There is a clear communication challenges between the public and private sector. There is not enough data sharing between those two channels that is affect also. And one thing that we really found is regarding the contracting with private sector for emergency care. Sometimes even in some country, we realize that there is a very complex bureaucratic contracting process that affects the engagement of the private sector and funding mechanisms. There are not clear funding mechanisms, how it should be reimbursed and how is the purchaser provider relationship in this regard. I can elaborate on the interventions to address these issues in my 1 or 2 minutes intervention in the next one. Thank you.
Thank you very much, Dr. Hamid. Definitely the issue for the enforcement of the regulations, I mean the governance, this is the most serious challenges facing the private sector in our region. Definitely. Of course, in addition to several other things, like, for example, the ministries of health capacity to formulate policies toward effective engagement with private health sector, but still the main challenges facing the private sector in our region again and again is the weakness for the enforcement of the regulation thing. Non-communicable disease public health challenges are complex, and actually it is addressing them require multiple actors involved. My question to Dr. Hisham, what is the role of the private health sector, and in particular for the profits, in providing non-communicable service if we are talking mainly about the primary health care? Over to you, Dr. Hisham.
Thank you. Thank you very much, Dr. Hassan, and thank you for inviting me. Yeah, the NCDs, as you know, are the leading cause of death in our region, and they are estimated to account for more than 62% of all death in the region, and approximately 2.5 million lives are lost annually due to NCDs. And many of this death could be prevented through lifestyle change and cost-effective interventions if they are implemented by national governments. Well, and NCDs also, they have slowly gained a kind of momentum towards becoming among national priorities and are now, I would say, well reflected in policies, guidelines, strategies, but generally little funding is allocated toward their control and management. And in addition to the measures taken by the government for the prevention and control of NCDs, it's one of the priority areas where government are looking for technical assistance is in how to engage with the private sector for its effective, I would say, or meaningful contribution to the implementation of national response to NCDs. So private sector can definitely support national NCD response by aligning their action with government policies to support public health outcomes to accelerate the implementation of NCD agenda and achieve also the SDG 3.4 targets. So as Aya mentioned, we have conducted that study to assess the engagement of for-profit private health sector in delivering NCD-related services in the region. And it was evident that the private sector, as Hala mentioned, has been active and growing in our region during the past couple of decades. And it remained the main provider. So the private sector regarding NCDs has traditionally been providing curative care and generally not seen to be really active in NCD prevention and reduction of risk factors. And it's, according to our assessment, is assumed to be better, I would say, preferred by the population due to less opportunity cost like travel and waiting time, existence of laboratory and diagnostic support, and maybe availability of drugs and medicine. However, there is no robust data supporting that the quality of the private health sector is better. But it seems that private health sector has won the trust of the masses of the population over the past years. Another point, it's that the purchase of specialized services such as hemodialysis or diagnostics of chronic care beds is a well-established tradition in our region also, but there is less practice of more initiatives or radical initiatives, such as those involving large-scale strategic purchasing of private medical services to be able to expand access and improve efficiency and utilization. So far, there are a few large-scale initiatives in which the private sector is appointed to achieve NCD policy goals, and this maybe should be endorsed by the policy changes, of course. Regarding the data, and I totally agree with colleagues, and Khalid mentioned that the collection, maintenance, and the flow of data and information from the private health sector remains really poor all across the region. So I would say the alignment of the private health sector with the public sector remains a challenge, and the two streams continue to work separately in many countries, and gradually the importance of incorporating private health sector is increasingly recognized in the public sector. But the effort remains sparse, rare, and fragmented. There is a lack of guidance, framework to engage private health sector in combating NCD at primary healthcare level, except for a few countries like Oman and others. So I'll stop here and back to you, Hassan.
Thank you, sir. Thank you very much, Dr. Hisham. Yes, definitely. I mean, the availability of data in most of the countries, it's one of the serious challenges. Again, I mean, the conducted in-depth assessment of almost 19 countries in our region was the first time ever to collect data about the private health sector. And in this data, in these countries, the private health sector is taking the lead in almost like 72%, if we are talking about the primary health care, and around 52% if we are talking about the hospital care. And the countries is still missing data about this sector. And the reason for this, by the way, because there is no formal reporting system between the private sector and the government or the Ministry of Health. The private health sector providers are responsible for almost more than 50% in some countries if we are talking about the modern methods of the contraception. And my question to Dr. Shebli from the UNFPA, what the challenges do you see for the ensuring of a good complementary with the public sector in the service provision if we're talking about reproductive, maternal, newborn, and adolescent health services? Over to you, Dr. Shebli, please.
Good afternoon, Sabah al-Khair. Good morning, colleagues. First of all, thank you very much, Dr. Hassan. I would like to thank you for inviting me today, and I'm very pleased to be here with my colleagues and friends with whom we collaborate very closely in the region. Yes, I agree with you. So first of all, I think we have to acknowledge the strong role that the private health sector is playing in terms of providing reproductive, maternal, child, adolescent health services. First of all, in terms of coverage, and this is particularly true for RMNCAH, if we know that almost 50% of the region's population doesn't have access to essential health services, including RMNCAH, family planning, antenatal care, emergency obstetric care, and so on. So I think the private health sector has a strong role to play in terms of contribution to UHC, universal health coverage, and to universal access to SRH service. In addition to the coverage, I think that the private health sector helps to overcome certain barriers. For instance, sociocultural barriers, administrative or legal barriers. And here I would like to explain, for instance, adolescent girls or unmarried women or illegal and irregular migrants, they have recourse to the private sector to overcome certain challenges and certain administrative barriers. Of course, it raises the issue of equity, but this has to be discussed separately. Also, the private health sector has been very effective in certain contexts, for instance, in the humanitarian context. And I would like here to share with you the experience of UNFPA in using, for instance, the voucher system in improving the skilled attendance in Syria in 2013, 14, and 15, or also the cash assistance, conditional or non-conditional in Jordan, to improve the access to emergency obstetric care. But that said, for instance, for sure, there are many challenges. And here I would like to summarize them in three main challenges. The first one is accountability and quality of care. The WHO review report mentions that the private health sector was minimal to non-existent in the development of clinical guidelines, standards, and policies in most countries. And I would like to add here that there is also a lack of adherence to national standards. For instance, in certain countries, you know that the rate of cesarean section is much higher in countries where the private health sector is very strong with providing emergency obstetric care. For instance, Egypt, Lebanon, Jordan. The private health sector also avoids high-risk services and management of complicated cases. For instance, for complicated deliveries, where they are referred to the public sector. And here it highlights big issues in terms of accountability vis-a-vis the population served, but also vis-a-vis the health. So this is the first challenge. The second challenge is the health information system. I think that our colleagues mentioned that very well, and Dr. Hamid said the poor communication and data sharing between the two sectors. I would like to say that this is also valid for RMNCAH. And the WHO report highlights that collected data in the public and private sector lack comprehensiveness and many vital indicators of RMNCAH. Here, I would like to say that we conducted a recent study in 5 countries in the region between UNFPA Astro and University Mohammed VI in Casablanca. It covered 5 countries, but also we had an expert group meeting so we can extrapolate the findings to the other countries. So that has shown that there is a very low involvement of the private health sector in notifying and reviewing maternal and perinatal deaths. And even when existing in the context where the reporting is mandated by law, the private health sector is not involved in the review nor in the response. And this is a big issue in terms of accountability. The third challenge, and I think it was also mentioned by other colleagues, but it's valid for RMNCAH, is the out-of-pocket burden and also the affordability. So I think that in terms of RMNCAH, despite the frequently associated out-of-pocket expenditure, EMOC services in the private health sector are preferred by the majority of the beneficiaries because they perceive that there is a better quality of care, maybe a less waiting time, the humanization of the services in the structures and so on. But for RMNCAH, catastrophic payments are common for private healthcare services, including cesarean section. And in addition, some reproductive health services are not covered by the health insurance. For instance, fertility treatment or family planning methods and services in many countries that are not covered by the health insurance, and this adds a certain financial burden to the beneficiary. So I think I will stop here. I will just conclude with one recommendation for now is the importance of mobilizing the private insurers to offer and cover complementary services and to contribute to decrease in mortality and morbidity, because this will constitute for sure a very valuable return on investment for both the private sector and the health system as a whole. Thank you very much.
Thanks a lot, Dr. Shibli Sahbani. Thank you very much. Still, we are talking about the reproductive, maternal, newborn, child, and adolescent health. And my question to Dr. Khalid Siddiq, how do you see the opportunities to ensure the proper contribution for the private health sector in achieving universal health coverage? Over to you, Dr. Khalid.
Thank you, Hassan, for the opportunity to talk about opportunities. And yeah, I think my colleagues, most of them, they focus on the challenge part, and I will be happy to highlight the opportunities, at least to come up with some positive notes in this panel discussion. I think from the presentation of Aya and the other talks, I don't need to emphasize the importance of the area of reproductive, maternal, newborn, child, and adolescent health, and how it is important to have a full engagement of the private sector with all the numbers that we have seen. And for some interventions, more than 90% of the coverage is being provided by the private sector. This is in an area that has been traditionally area provided by public health sector, but we have seen recently this growing engagement and contribution of the private sector. So talking about opportunities, I will be talking about three big groups of opportunities with some example. We feel that in our area, the key opportunity we have is existing country commitments, the global and regional country commitments. These are the opportunities that we need to build on. We all as partners together with the government. We know that all our countries in the region are signatories of Sustainable Developmental Goals of SDGs, but also they are signatories to so many other initiatives, strategies, and frameworks, such as the Global Strategy for Women, Children, and Adolescent Health 2016-2030. And we have also Every Newborn Action Plan 2014, the Global Accelerated Action for the Health of Adolescents. And at the regional level, just 2 years ago, our member states, they endorsed the regional framework for newborn, child, and adolescent health 2019-2023. All these strategies and frameworks where our countries are signatories, all of them, they have a strong link to the role of the private sector, to the provision of reproductive, maternal, newborn, child, and adolescent health. I think that this is something an opportunity that we can build upon. In addition to that, and based on the analysis that we have done on the engagement of private sector in the area of maternal and child health in general, we have seen a few examples of opportunities in our countries. The first thing that we have seen some instances in the countries where the governance aspect of private sector engagement in RMNCAH was done with full participation of the private sector representatives themselves. And we have here an example from Egypt, where during the policy making of national initiatives such as family planning, the private sector representatives were part of the table where people are discussing and deciding on that. In addition, also, although regulatory mechanisms are, the universal challenge that facing everybody, but also we have seen in some countries like Oman, they are having regulatory mechanisms that are proved to be very effective, and the evidence showed that they are having influence on the private sector. In addition, another example on the capacity building also, there are so many examples in our region drawn from this assessment that countries have good examples of capacity building for private healthcare providers, resulting in improving the quality of care, which is a big issue that is being discussed by our colleagues here. And I think the issue of insurance also, we have good opportunities to build on the private insurance into RMNCAH services with very good examples. And the final example in this area is what we call them informal or indirect referral linkages between the private sector and the public sector. They are already there. So just what maybe we need to further strengthen the existing linkages and see how we can leverage this opportunity. The last opportunity, or the group of under the group of opportunities I wanted to talk about, is the momentum around universal health coverage. We see the UHCC momentum in our countries is really high over the past few years, and we have seen that many countries either developed or are developing their priority benefit packages with very strong representation of the private sector, either as service provider or sometimes as governing bodies. And we have seen this in countries, for example, like Pakistan. It gives the government more authority, and also it helps to put the government in the driver's seat when we are talking about private sector engagement. So these are the just examples of the opportunities that we have. Thank you so much, Hassan.
Thank you very much, Khaled. Actually, I'm very happy with this discussion. This is, by the way, this is the first formal discussion about the role of the private health sector in maintaining and the provision of the essential health service in WHO. I mean, we always rely about the public sector to maintain the essential service. Having this kind of discussion, really appreciate it a lot. My closing question, and it is actually directed to all the panel members, about how do you see the way forward to ensure the proper contribution of the private health sector to maintain the essential health service toward universal health coverage, of course. And let us start with Dr. Anriban. Yes, Dr. Anriban, over to you, sir.
Thank you, Hassan, and good afternoon to all colleagues. It's such a pleasure to be part of this discussion, and very happy on behalf of UNICEF to be able to both contribute to this discussion, but also to help move some of the agenda forward in multiple countries in the region where we work together. I think what is very clear and was presented both in the data from Aya, but also in the interventions by all the colleagues, is how significant the private sector is. And you really cannot engage with that such a significant, if you don't see the partner, if you don't see the partnership with the private sector as really a shared value partnership with somebody who is investing, an investor into the sector, and not necessarily as a group of individuals or companies who will need to be just regulated. So I think the first important area is to be seeing that partnership, seeing it more as a partnership rather than just as regulation and enforcement. Not to minimize the role of enforcement, not to minimize the role of setting standards, not to minimize the role of ensuring that there is no inequity. But again, we've heard also from another distinguished panel member here, how in the public's perception, the private sector is affording better quality care, even though there is no definitive data. And if we look back, a lot of it might have to do with how the customer service is done. If you think of the beneficiary as a customer and being able to see, in the same way, we will have to bring together those shared value partnerships. The private sector and the public sector have different intermediate goals. But at the end of the day, how do we make sure that the overall results, no private sector provider doesn't want their clients not to get well. They are charging more for it, maybe certainly more than where in cases it is free. But the intent is not here not to get the person well. Same in terms of insurance. If you think of private sector insurance, the goal overall is to how do we make that work for all segments of society, and not to create a situation where the rich go to the, or rather anybody who can afford goes to the private, and then the public, there are very few going. The the perception and image of the public sector diminishes, and the investments subsequently diminish, because then if nobody is going, there is no demand. Why invest in this? The second point is seeing the private sector also as an important contributor in economic terms. I think one of the panelists talked about the human resources. Clearly, this is very important, and we've seen that in other regions where you have learned is a huge outflow of human resources for health from public to the private. And how do we also in an area where there is less, where there are challenges to economic growth, see the private sector, as they're providing services also, in terms of an overall contributor to the economy, both in employing, generating employment, but also in terms of taxes, where their engagement is seen as a productive part of the economy, rather than as something that is taking away, what the public sector could have provided. My last point is on how do we do all of this if all the discussion on the sector, on the governance of the health sector is happening in one corner of the room, and all, the majority of the discussion or the partners who are contributing to the bulk of the service delivery are not even in the room. I was very interested to hear of the good experience that a few colleagues mentioned about how the private sector has been involved in the governance. Clearly, we will have to, see how that is done in a manner that is efficient use of time and, in line with what sovereign governments see as the national vision. But clearly, without having them in the discussion, whether it is about setting standards, whether it is about, discussing priorities for the sector, for the government, and for human resources, without having them in a meaningful manner with a shared value partnership, I don't think we will be able to move. We see very much businesses as contributing to results, certainly in the context of UNICEF results for children, but certainly very much as results for the health of every woman, child, and family member in this region. Thank you.
Thanks a lot, Dr. Andriban. Yes, definitely have a very valid point about where is the private sector from all of this kind of discussions. You're already familiar. Last year, we tried several times to approach a policy dialogue with a number of countries. It didn't work, mainly because of the priorities for the countries so far was the current pandemic. But anyway, during this year, actually, we're in the process of trying to have more, or to build a policy dialogue in 3 countries, and this is including Sudan, Pakistan, and Palestine. We'll have a separate discussion with you about this, and we'll proceed accordingly. Okay, we would like to get the view from Dr. Khalid Siddi. Over to you, Dr. Khalid.
Yeah, thank you. I think this would be a quick one. So just to give the opportunity to colleagues also to participate. I think one of the key forward steps that we need to agree upon regarding our area of work in reproductive, maternal, newborn, child, and adolescent health is around the idea that the private sector is mainly focusing on the curative aspect currently in most of, because of the monetary, interest in this. But we think that they should be incentivized to engage more in the promotive and preventive services, because if we are talking about UHSE, we cannot focus only on one aspect of the services, which are the curative, and leaving out, I think the 3/4 maybe of services which are the preventive and promotive services. Thank you.
Thank you, sir. Thank you very much. Dr. Shibli Sahbani, please, from UNFPA. Over to you, sir.
Thank you very much, Dr. Hassan. I think this one will be quicker than Khalid's one. So I don't want to repeat what was already said in terms of opportunities and also recommendations. But I want just to highlight the importance of involving the private health sector in decision making, in research, and in evidence-based programming, because this will definitely contribute to the private health sector adherence to the national protocol standards and guidelines and SOPs, and it will also improve data and information sharing. Because if you involve me in the decision and I understand what would be my role in contributing to the decision making, for sure I will provide the information and the data required. Thank you very much.
Thank you, Dr. Shamil. Dr. Hisham El-Peri, please.
Yeah, thank you very much, Hassan. A lot of important thought and ideas has been highlighted, and I will echo maybe what Khalid Said mentioned. And as countries they're moving toward universal health coverage as a part of the 2030 agenda for SDGs. So there is, I would say, more room for targeted intervention in the private sector to be able to address the quality, to improve the efficiency, and encourage the provision of specific services. Mainly, I'm thinking about the most pressing needs in terms of NCDs. Just to mention that the transition to UHC in health systems facing the growing burden of chronic NCDs will definitely require policies that recognize the links between the public and the private sector and the various roles they play in health system strengthening. Thank you very much, Hassan, and over to you.
Thanks, Rod, sir. Thank you very much. Dr. Khalid Said, please.
Yeah. Thank you very much, Hassan. I think I'll take from what Hisham is saying, that gradually what we are seeing is that the burden is shifting from more acute towards a more chronic disease profile in most of the countries in this region. Fine, there are some exceptions. So we need to also see that the traditional role of private sector in providing care for few conditions and not being involved in promotion, prevention, and more importantly, rehabilitation. Because when we are talking about chronic conditions, be they mental health problems, be they non-communicable diseases, rehabilitation, particularly with the growing profile in countries of population aging. If we look going forward until 2050, a significant proportion in most of the countries in this region would have aged. Significant proportion would have aged beyond 65. So that would mean that the chronic conditions would become more important, and conditions like dementia, for example, we're already seeing an upsurge in that in a number of countries. So we need to also start thinking in terms of how private sector can play a role in rehabilitation and at the same time in end of life care kind of areas, which traditionally they are not involved in, besides prevention and promotion. So that is one issue. Second thing I think is important for us to remember, as I mentioned earlier, the emergencies issue. That interventions by the private sector, and I'm talking not only for health sector, but for example, financial institutions, how can they be important players to make sure that disenfranchisement, for example, which is one of the main drivers of conflict and problems across countries, how can they play a role in that to make sure the dividends which would come from that, which would obviously include health, education, peace, and so on. So that, I think, is another area which we need to probably expand our horizons to and start thinking beyond the traditional remit of health sector to involving the people who are private sector has already been mentioned as an employment generator, but at the same time, it's not just health sector, it's other sectors as well. And I think somebody mentioned earlier on about the conditional cash transfers, for example, which are well known to improve maternal mental health and so on. So maybe we should need to think in terms of engaging with the private sector beyond the remit of traditional health. if we really want to work in the areas of prevention, promotion, end-of-life care, and rehabilitation to work. And this is particularly true for mental health conditions as well as other non-communicable diseases. Thank you.
Thanks a lot, Dr. Khalid. Thank you very much. Dr. Ayoub Al-Jawalda, please.
Thank you, Dr. Hassan. I think we all agreed that there is a strong partnership between private and public, and this partnership, it's in fact in the area of nutrition and food industry, it's in the ground, and they are being implementing, of course, most of the recommendation of the member states to enforce nutrition and promoting healthy diet. Now, while they are implementing this, or they are taking the major part of the production of food and to make sure that it's healthy and nutritious and meeting the recommendation and the quality control, we need to enforce our regulatory measures and the legislation. For example, most of the countries, they have open borders, and you can import any food product unless you have regulatory measures and regulation and strong governance. You cannot really control the quality of the food you are importing, knowing that salt, fat, sugar reduction to address NCD risk factors is one of the big challenges in our region. Also, food fortification with micronutrients. Most of the mills they produce, but we have to make sure what they are producing is meeting the recommendation. So we need strong monitoring system and strong legislation. Thank you.
Thank you very much, Dr. Ayoub. Dr. Hamid, please.
Thank you very much. Just it is important to mention that the emergency care should be accessible to all throughout the region. So regardless of their ability to pay, therefore, private sector should have role in this. For this reason, we have a few very strategic intervention. First of all, each member state needs to do a study to see what is the public-private partnership in emergency care. And in the light of this study, and with a good governance, they clearly mention and define the role of public-private sector in the emergency care provision with a very clear local and regional clinical pathways. Also, we need to have a very clear legislation with a simplified contracting process led by the data-driven approach and appropriate communication. The funding mechanisms, which is sustainable for emergency care, is very important, and COVID-19 showed that really we need a sustainable funding. And we have seen the good practices from some non-profit private sectors in the providing the services and also dealing with the governance in 2 or 3 countries. And the quality standards definition is very important. And my last comment is pre-hospital should be very clearly identified, because when we say emergency care, always we are thinking about the facility base. So we need a centrally dispatched mechanism, regardless of the kind of and type of the provider. So I'm sure we need to work more on the engagement of the private sector, and COVID-19 showed that this is an important matter in the region. Thank you.
Thanks a lot, Dr. Hamid, really appreciate it. Dr. Halasar.
Just, I mean, Hamid, in terms of emergency care, has said it all in terms of the findings of the study. I just want to emphasize a few things, starting by his saying that it should be accessible and free to all. And this should be applicable to the private sector as well, and underlines the importance of having governance mechanisms and legislative frameworks that are binding to all sectors under one strategic national vision that, based on agreed values and goals, data transfer in a transparent way, as well as standards that ensure the quality of care that is offered by the different providers, ensuring that the linkages are maintained across all providers with fair distribution of resources. This is very important, bringing the private sector, giving the important role it plays under one national umbrella with clear strategic vision, definition of resources, definition of roles, and sort of definition of mandates and commitments that are binding to all parties in order to ensure accessible, equitable services under the overall umbrella of universal health coverage. Thank you.
Thanks a lot. Thank you very much, Dr. Hala. Last but not least, of course, our colleague, Dr. Huda Ata. Over to you.
Thank you, Dr. Salah. Several issues have been highlighted by other colleagues, but I would like to highlight the opportunities in the coming era, because we are in the era of the digital health. The issue of reporting can be really overcome by the availability of the online digital single platform for all public, for all sectors to report, private and public. This is, for example, the DHIS2 that has been adopted by some countries. This also highlights the importance of scaling and expanding the training material using the online system, because before the training had been limited to the face-to-face training with few colleagues coming from the public facilities mainly, but now we can roll out all the training and awareness about the guideline and the standard to all sectors using the digital platform. Colleagues highlighted the issue of the partnership, public-private partnership. I have to say it exists in some diseases. What is needed now is to make it expanded to cover all communicable diseases and other conditions as well, not only communicable, and guided by the SDG goals. So I see the UHC agenda is an opportunity to build effective engagement and consensus and framework for public and private sector to work together. Thank you.
Thank you. Thank you very much, really, Dr. Huda. And thanks a lot for the whole panel member for the excellent discussion, actually. My closing remark that public sector alone cannot maintain the essential health service. No way in our region. And for the current or the recent assessment that we conducted in several countries, communicable disease, non-communicable disease, mental health, nutrition, emergency, private sector has a major role by way or other. And the current pandemic, actually, it gives us a good opportunity to go and to encourage the countries to go for the effective engagement with private health sector. Without such strong engagement with private health sector, universal health coverage or the health security will continue as a dream, actually, in many countries in our region. Thank you very much, colleague. Thanks a lot. Goodbye.